Do you frequently feel like your heart aches sometimes? Or have you noticed unexplained bruises after just a light bump? Maybe you've had a blood clot after a long flight or surgery when others didn't. If so, your body might be forming clots too easily. And one hidden reason could be something called the prothrombin gene mutation. It's not a disease you catch like a cold. Instead, it's a quiet change in your DNA that makes your blood clot more than it should. Think of it like having an overactive alarm system in your house. It goes off even when there's no real danger. This mutation is one of the more common inherited causes of abnormal blood clotting. But here's the good news. Once you know it's there, you can manage it and live a totally normal life. So what causes this overactive clotting system? It's all in your genes, specifically a typo in a gene called F2, which makes a protein named prothrombin. Prothrombin is like a messenger in your blood that helps form clots when you're injured. But in people with this mutation, the body makes too much prothrombin even when it's not needed. Imagine a printer that keeps printing pages. Even when you didn't press print, that's what your body is doing with clotting factors. This mutation is inherited, meaning you get it from one or both parents. If one parent has it, you have a 50% chance of getting it. If both have it, the chance increases. But having the gene doesn't always mean you'll get clots. Some people live their whole lives without knowing they have it. Now here's the tricky part. Many people with the prothrombin gene mutation don't feel any signs, at least not at first. But when symptoms do show up, they can be serious. Have you ever had a leg that suddenly swelled up, turned red, and felt warm? That could be a deep vein thrombosis, DVT, a dangerous blood clot in the leg. Or maybe you've had sudden chest pain and trouble breathing. That might be a clot in the lungs, pulmonary embolism. These warning signs often come during high-risk times, like when you're on a long flight, pregnant, or recovering from surgery. Women taking birth control or hormone therapy may also be at higher risk. The mutation itself doesn't give you daily symptoms, but it increases your risk of life-changing or even life-threatening clots when other factors pile up. So how do doctors find this hidden gene glitch? If you've had a clot or have a family history, your doctor might order a simple blood test, not a regular one, but a special genetic test that checks for the G20210, a mutation in the F2 gene. Think of it like running a spell check on your DNA. Sometimes it's found during fertility testing or after a miscarriage, especially in women. Once confirmed, treatment isn't about curing the gene, because we can't change your DNA yet, but about preventing clots. If you're at risk, doctors may suggest blood thinners, like warfarin or newer pills like rivaroxaban, especially during high-risk times like surgery or pregnancy. For example, a woman with this mutation might take a low-dose blood thinner during pregnancy to protect both herself and the baby. Monitoring and timing are key. It's like wearing a seatbelt. You don't need it every second, but it's vital when the risk is high. Since you can't change your genes, prevention focuses on managing risks. Ask yourself, do you sit for hours every day, take long flights, smoke, or use hormonal birth control? These choices stack the odds against you if you have the mutation. The best prevention plan is awareness and action. Stay active, stretch your legs every hour if you work at a desk. Drink water to keep your blood flowing smoothly. If you're planning surgery or pregnancy, tell your doctor about your family history. For women, choosing non-hormonal birth control may be safer. It's like weathering a storm. You can't stop the thunder, but you can stay indoors. Regular checkups and open talks with your doctor help you stay one step ahead. Scientists aren't stopping at just detecting the mutation. They're learning how to better predict who will actually develop clots. Recent studies are combining gene data with lifestyle and blood tests to create risk scores, almost like a clot forecast. For example, researchers are looking at whether other genes or proteins in the blood make the mutation more dangerous. There are also trials testing safer, shorter-term use of blood thinners for high-risk situations. One exciting area is personalized medicine, using your unique genetic profile to decide exactly when and how long you should be on medication. Imagine getting a health plan that's built just for your body. That's where we're headed. While gene editing, like CRISPR, is still far off for this condition, knowledge is power. And every year we get